Committee on Education and the Workforce will come to order. A quorum being present, the committee meets today to consider H.R. 4843. Given time constraints, I ask members to insert any written statements into the record. I will hold the record open until the end of the day in order to accommodate those members who may not have prepared written statements. I now recognize myself for an opening statement. Again, good morning. Today, the committee will take an important step in preventing the abuse and neglect of infants born with opioid addiction. As we all know, an opioid epidemic has swept across the country. This epidemic is destroying communities, it is destroying families, it is destroying lives, and perhaps most tragically, it is destroying the lives of the most vulnerable among us. The Child Abuse Prevention and Treatment Act has long provided grants to states to help prevent child abuse and neglect, as well as identify, assess, and treat the victims. In order to receive federal funding, states have to provide some basic assurances about their child welfare policies. For example, states have to assure there are policies in place to notify Child Protective Services when a newborn is identified with the symptoms of illegal substance abuse, as well as policies for the development of a safe care plan for the newborn. Sadly, an unwillingness to follow and enforce the law is leading to tragic consequences. In 2015, Reuters spent a year investigating cases of infants born to parents struggling with opioid addiction. As is often the case with addiction, the parent struggle had repercussions for those around them, including their newborns. According to Reuters, more than 130,000 babies born in the United States in the last decade entered the world addicted to drugs. That is a startling statistic on its own, but even more startling are the stories of infants who, after suffering through the pain of withdrawal, later suffered deaths that should have been prevented. Of the fatalities the report examined, more than 40 children died of suffocation. 13 others died after swallowing toxic doses of opioids. Some of the stories are simply too painful and disturbing to mention, and again, the saddest part of this is that these tragedies should have been prevented. Needless to say, this report raised a number of red flags. It prompted us to write to the Department of Health and Human Services in an effort to better understand the process for reviewing and approving state applications for federal funds. It's fair to say that the response we received was disappointing, suggesting that changes to the law somehow absolved the department from its enforcement responsibilities. Regardless of any changes to the law in recent years, it was never Congress's intent to cut a blank check to states who fail to follow the law. These parents and their children deserve better. Fortunately, efforts are underway to provide real help and hope to these families. Programs like Lily's Place, an infant recovery center in West Virginia, are not only helping to wean children off of the drugs they are born addicted to, but also teaching mothers how to care for infants suffering through withdrawal. This is just one of a handful of similar programs across the country and an excellent example of the work being done to address the country's growing opioid epidemic. While these community efforts are vitally important, there are also steps we in Congress can take to help ensure these vulnerable women and children no longer slip through the cracks. The Improving Safe Care for the Prevention of Infant Abuse and Neglect Act is part of that effort. This common-sense measure will require the Department of Health and Human Services to better ensure states are meeting current child welfare requirements. It makes clear the Department's responsibilities in confirming states have policies in place to prevent and respond to child abuse and neglect, particularly infants exposed to illegal substances before birth. The bill also includes provisions that will improve accountability and help states develop plans to keep infants and their families healthy and safe. In short, it strengthens the current system and helps address a real immediate need. I want to thank Mr. Barletta and Ms. Clark for their leadership on this issue and for working together to deliver the bipartisan proposal under consideration today. I'm confident their work will be an important part of the House's larger effort to combat the country's growing opioid epidemic. Too many American families are struggling with the consequence of this national crisis, and it's time we as policymakers and as a nation said enough. I urge my colleagues to support this legislation, and I will now recognize Ranking Member Mr. Scott for his opening remarks.
Thank you, Mr. Chairman. Mr. Chairman, one of the committee's main priorities is to ensure that children have quality opportunities early in life to succeed later on in college and career. Children born dependent on addictive substances face severe obstacles to overcome, and tragically, some of these children even die from neglect, but this doesn't have to happen. The Child Abuse Prevention and Treatment Act, CAPTA, which originally passed in 1974, is meant to support these infants born addicted to illegal substances. Unfortunately, nearly every state fails to follow CAPTA requirements that are meant to ensure that children born in these circumstances have a plan of safe care that will help them grow into healthy toddlers in supportive environments. This bill, the Improving Safe Care for the Prevention of Infant Abuse and Neglect Act, is a strong, positive first step in safeguard the well-being of our nation's most vulnerable children and to help families and caregivers receive the guidance and support they need in order to provide a nurturing environment for their children. The bill requires states to follow through on their insurances in their CAPTA state plans to protect infants suffering from drug dependency. It also works to provide additional data on how many infants are born drug dependent, and of those infants, how many actually receive proper referrals and services. It is important to emphasize that drug dependency is a public health crisis. As such, it should be treated like any other public health crisis. Investments in prevention, intervention, and treatment are required. Studies find that spending much more money on incarceration can even be counterproductive. And this is why I co-sponsored the Comprehensive Addiction and Recovery Act, CARA, which passed the Senate 94-1, and is another one of the bills the House of Representatives is looking to move as part of its initiative to address the opioid crisis. Unfortunately, this committee is not considering CARA provisions that fall under our jurisdiction, including important prevention and recovery programs, such as the Prevention High Schools and College Recovery Programs. The recovery schools prevent adolescents and young adults from slipping into full opioid dependency, and recovery community organizations are providing the safety net for individuals who are indigent or involved in the justice system. Investing in these programs is imperative, as there are still long waiting lists, 3 weeks in some parts of my district, for those who are trying to seek treatment. Now, these important provisions were in the original CARA bill, and everyone assumed they would be reported by the House Judiciary Committee, but another bill is being considered, and these provisions are not being brought up in the Judiciary Committee. So I hope, Mr. Chairman, that we can work together to make sure these provisions remain, because they're in the Senate bill, during conference on CARA or any other opportunity. So I welcome this bipartisan agreement to amend CAPTA as part of the effort to intervene and treat those affected with substance abuse. This bill, however, is not a substitute for a complete reauthorization of CAPTA. The only way to fully address the public health crisis of substance abuse is to address all of the provisions laid out in CAPTA, not just the standalone provisions highlighted in recent news reports. I look forward to using this bill as a springboard for future discussions and reaching further agreement on legislative initiatives needed to help Americans struggling with drug addiction. But I am delighted, Mr. Chairman, that the steps we're taking today are founded in research and evidence, and not the slogans and sound bites that usually guide discussions on drug policy. So I'm delighted to support the bill today. And thank you, and I yield back.
I thank the gentleman. The committee will now proceed to the consideration of the bill, H.R. 4843, for amendment. Without objection, the bill will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I will soon recognize Mr. Barletta to offer an amendment in the nature of a substitute. Without objection, the amendment shall be considered original text and open to amendment at any point. The amendment in the nature of a substitute has already been distributed and is in each of your folders. I now recognize Mr. Barletta for 5 minutes to explain the substitute.
Thank you, Chairman Klein. I'm happy to have the opportunity today to consider this important bipartisan proposal. Substance abuse is a problem that afflicts millions of Americans, and it is something that I consistently hear about when I am back home in Pennsylvania. While its damaging effects are felt across our society, the most tragic cases are those involving newborns. Children who are exposed to illegal substances before they are born are helpless in avoiding the pain and suffering caused by addiction, and so many infants enter this world without even a fighting chance. In fact, every 25 minutes in this country, a baby is born having already been exposed to drugs and suffering from opiate withdrawal. These children will pay the price for something they had absolutely no control over, something they were defenseless against. That's why it's so important we do everything we can to prevent these heartbreaking situations and ensure all children have the protection and the care that they need. This priority is one that reaches across party lines, and it's the reason that we are here today. Federal policies have long supported state efforts to identify, assess, and treat children who are victims of abuse and neglect. One of those policies is the Child Abuse Prevention and Treatment Act, or CAPTA. Enacted in 1974, CAPTA provides states with resources to improve their child protective services systems, provided they assure the Department of Health and Human Services that they have put in place certain child welfare policies. These policies include requiring health care providers to notify state child protective service agencies when a child is born with prenatal illegal substance exposure, as well as requiring the development of a safe care plan to protect these newborns and keep them and their caregivers healthy. Unfortunately, even with this process in place, it's become clear that the system is failing some of our most helpless children and their families. The report that Chairman Klein discussed revealed the administration is not fulfilling its responsibility to properly enforce the law. As a result, some states are getting federal funds without having the necessary child welfare policies in place. That means taxpayer dollars are being wasted, and more importantly, children who need help aren't getting it. That's unacceptable, and that's why Representative Clark and I, along with a number of our colleagues on both sides of the aisle, introduced the bill before us today, the Improving Safe Care for the Prevention of Infant Abuse and Neglect Act. This proposal demands that HHS do better when it comes to enforcing policies meant to protect children from abuse and neglect. It requires the department to review and confirm states have put in place policies required by CAPTA. It strengthens protections for infants born with illegal substance exposure, and it improves accountability related to the care of those infants and their families. It also includes provisions to provide states with best practices for developing plans to keep infants and their caregivers healthy and safe, and to encourage the use of information made available through other child welfare laws. The bill will prevent HHS from adding new requirements to state assurances and plans. Together, these measures will ensure current policies are being enforced and will strengthen efforts to prevent and respond to child abuse and neglect. In doing so, the bill will help put an end to a pattern of neglect that has led to shocking and deadly consequences, and ensure children and families receive the help and care that they desperately need. The substitute amendment I am offering today is the product of discussions with lawmakers and stakeholders to provide additional clarification and make technical changes to the underlying bill. These changes would clarify that HHS secretaries should provide states information on safe care plan requirements, that substance use disorder treatment needs should be considered as part of those plans, and that states should monitor their use. The amendment would also make clear that the Secretary cannot create new requirements for states under CAPTA and change the title of the bill to the Infant Plan of Care Safe Care Improvement Act. I urge my colleagues to support the substitute as well as the underlying legislation, and I yield back the balance of my time.
Gentleman yields back. Are there other members seeking recognition on the substitute? Ms. Clark.
Thank you, Mr. Chairman. I am pleased to join with you, Ranking Member Scott, and Representative Barletta to introduce this important bill to help the most vulnerable victims of the opioid epidemic. In every corner of our country, the opioid crisis is having a devastating effect. In Massachusetts last year, over 1,100 people succumbed to fatal overdoses. Nationwide, drug overdoses is the leading cause of accidental death. This epidemic does not see race, gender, income, or political persuasion, and it does not spare newborns and infants. We know, as Representative just stated, that every 25 minutes, a baby is born suffering from opioid withdrawal in our country. This is a symptom known as neonatal abstinence syndrome. And while there is no silver bullet to addressing this crisis with our newborns and in our country, this bill before us today will make critical changes. The Infant Plan of Safe Care Improvement Act will help us strengthen the care plans required by the Child Abuse and Prevention Act. This bill will help infants by ensuring that states have access to the best practices for establishing safe care plans for newborns with prenatal substance exposure, tracking every infant with a safe care plan, and making clear that services for these babies includes services for family members and caregivers. We know that children have the best opportunity to thrive when their parents and caregivers are the center of care. And I am very grateful that we're taking steps with this bill to ensure that the whole family is healthy and successful. Thank you, Mr. Chairman, and I yield back.
Gentlelady yields back. Other members wishing to speak? Mr. Messer.
Thank you, Mr. Chairman. I want to rise in support of this important bill to protect our infants in this country from abuse and neglect. It's an example of what can happen in this town when we work together. I also want to rise to recognize two very important people in the room today. One of my daughters and my son, Ava and Hudson, are back here. Stand up, you guys. It is Take Your Child to Work Day, and we were blessed to have the opportunity for them to be here with me. Thank you, Mr. Chairman, and I yield back.
Other members wishing to speak? Dr. Heck.
Thank you, Mr. Chairman. I rise in support of this important legislation. As an emergency department physician at an inner-city hospital, I've seen firsthand the tragedy of our nationwide opioid abuse epidemic. And as the husband of a neonatal ICU nurse, I've heard firsthand accounts of the even greater tragedy, a baby born with prenatal exposure to an illegal substance and the ravages of neonatal abstinence syndrome. While several pieces of legislation are working their way through the House and Senate to address the national scourge of opioid abuse, I'm pleased that the Committee on Education and the Workforce, in a bipartisan way, is addressing the protection and care of our most vulnerable, the infants who are born with opioid addiction. I urge my colleagues to support the substitute amendment and the underlying bill, H.R. 4843, and yield back the balance of my time.
Let's see, we've got a whole bunch of people here. Oh, sorry. Ms. Bonamici, you're recognized.
Thank you, Mr. Chairman. I'm glad our committee is taking this important step today to help respond to the opioid epidemic in our country and the threat that substance abuse poses to mothers and newborn children. One study found that the incidence of neonatal abstinence syndrome rose 300% between 2000 and 2009. I want to recognize Congressman Barletta, Congresswoman Clark, Chairman Klein, Ranking Member Scott, Congressman Polis, and Congressman Walberg for working together to craft this common-sense legislation that will strengthen the Child Abuse Prevention and Treatment Act. This legislation will give states support and direction to deliver adequate services to infants who are born with substance exposure and to their families. Expanding prenatal and postpartum addiction treatment will improve the health of infants and mothers. I've seen this work in my home state, in Oregon. Health Share of Oregon, a coordinated care organization in Portland, provides integrated care for mothers with addiction and their children, some of whom are born with withdrawal syndromes. Their program, called Project Nurture, supports families during their pregnancy and for a year after their children are born. Families receive substance abuse treatment, mental health services, and parenting resources. The majority of mothers who have participated in the program are now parenting successfully. Project Nurture is an example of the kind of integrated care that mothers and families need to treat substance abuse disorders and protect infants who have been exposed to harmful substances. Importantly, by showing families how they can provide a safe and healthy environment for their children, Project Nurture encourages mothers to seek treatment, not to avoid care out of fear they'll lose custody of their children. The legislation we're considering today will advance this kind of care and contribute to better outcomes for families struggling with addiction. I'm happy to offer my support for this legislation, and I thank you again, Mr. Chairman, and yield back the balance of my time.
Thank the gentlelady. Mr. Wilson.
Thank you, Chairman Klein. I'm grateful for the leadership of Chairman John Klein and Congressman Lou Barletta for their leadership on this important issue. I appreciate that Chairman Klein was in attendance until 3 a.m. last night at the House Armed Services Committee markup, and then, of course, he was on duty here early to preside today, and so Chairman Klein never stops. According to the National Institute on Drug Abuse, a child is born every 25 minutes suffering from opioid withdrawal. This is a five-fold increase since 2000 that leaves children spending more time in the hospital and struggling with developmental and behavioral issues throughout early childhood. As we see the damage of substance abuse throughout our communities, it is vital that we protect those who enter the world defenseless against drug addiction. I am grateful to support H.R. 4843, the Improving Safe Care for the Prevention of Infant Abuse and Neglect Act, which will strengthen protection and accountability measures for infants born with neonatal abstinence syndrome. This legislation is crucial to protecting future generations, and I look forward to continuing to work with my colleagues in a bipartisan manner to ensure that the most vulnerable among us are cared for and protected. I urge this legislation's passage, and I yield back.
Gentleman yields back. I thank the gentleman for pointing out that there are a number of us here today who were in a 15-hour markup yesterday, ending shortly before 3 a.m. this morning. There are 8 members of this committee on the Armed Service Committee, and I'm proud to say most of those 8 are here. I want this markup to go considerably faster. Mr. Hinojosa, you're recognized.
Yes, sir. Mr. Chairman, I commend the committee leadership in both chambers for advancing this bill, which represents a bipartisan and bicameral effort to protect children from the damage of substance abuse, of addiction to pain-killing medicine. While the last Child Abuse Prevention and Treatment Act, authorized in 2010, was a step in the right direction, it did not provide for sufficient resources or oversight to make sure the law is working towards its objective of protecting these addicted infants. I am pleased to support this bill as a measure to ensure that the states implement plans of action to keep infants and their caregivers healthy and safe. The bill will provide resources and best practices to the states and requires the U.S. Department of Health and Human Services to verify that the states have implemented those plans pursuant to the intent of the original law. And according to the Journal of the American Medical Association, the rate of newborns experiencing withdrawal symptoms has tripled. In response, the Texas Department of State Health Services requested the state legislature to provide $7.7 million in the upcoming budget and $9.3 million in the following year for outreach, screening women for this opioid use and treatment. Mr. Chairman, I am pleased to support H.R. 4843 and the amendment offered by Congressman Barletta of Pennsylvania to protect the unborn, the most defenseless and vulnerable among us, as a response to address this very painful and costly problem and to provide the treatment and prevention necessary to reduce its incidence overall. I look forward to working with Chairman Klein and Ranking Member Bobby Scott, and I yield back the balance of my time.
The gentleman yields back. Dr. Rowe, you're recognized.
Thank you, Mr. Chairman, and thank those of you all who brought this very needed bill to our attention. In the state of Tennessee, and this is very personal with me, in our state, prescription drug overdose deaths have increased in 2001 from 422 to over 1,600 last year. It's more than automobile wrecks, homicide, suicide, and to bring it down to what I did for a living, which was as an obstetrician, deliver babies. When I was in practice, I almost never saw a drug-addicted baby, almost never. In our state, and I know you can't see this graph probably, but it shows the incredible increase that's occurred from 1999 to about less than 100 to now 1,000, almost 1,000 babies in our state that are drug addicted. We have now changed in our neonatal intensive care unit at home and opened a 25-bed neonatal intensive care unit just for drug addicted babies. And if you've never seen one of these children, these precious children, withdrawal. When they shake, they have seizures, they have diarrhea, vomiting, and on, and it's all preventable. That's the human cost. The real cost to get this child withdrawn from drugs and basically out into the home is over $65,000 per baby, where a normal baby is about $4,000. And 80% of these children are on Medicaid. 1 in 4 does not end up in the home after 1 year. This is a tragedy beyond description, and I want to thank every person here who's spoken out in favor of this bill. And with that, I yield back.
Gentleman yields back. Other members wishing to speak on the bill? If not, we'll move to amendments. Does anyone seek recognition to offer an amendment? Mr. Polis.
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk will distribute the amendment. Dr. Rowe.
Mr. Chairman, I reserve a point of order on the amendment.
Gentleman reserves a point of order. Which amendment, Jared?
The one that I have marked as 1 is the marijuana study amendment.
Okay.
Is that one?
Staff found that amendment. Yes, okay, please distribute the amendment, and Mr. Polis, if you wait just a minute until we get a peek at it. This looks short enough for us to read. The gentleman is recognized for 5 minutes to explain his amendment.
Okay, yes, and this is the correct amendment. So this is Polis Amendment 1. Thank you, Mr. Chairman. The first amendment I'm offering today directs the NIH to conduct a study on the medical application of marijuana for pain management, including a comparison of the degrees to which marijuana and opioids are addictive, are harmful to health, and a study of the overdose deaths in states with and without medical marijuana laws. In the policy realm, we've suffered from a dearth of good scientific information in this area. And of course, the bill we're dealing with is concerned with newborn drug withdrawal. It, of course, is rooted in the wider problem of opiate dependency, much of which stems from the misuse of prescription drugs originally intended for pain management. Medical marijuana is a possible way to reduce the use of prescription painkillers for chronic pain, and yet it hasn't really been explored, in large part because of the federal government's monopoly on legal cultivation and studies. And I really offer this amendment to help spur discussion about the viability of using marijuana for pain management in lieu of opiates. There already have been some third-party and medical journals that have produced encouraging studies about how cannabis can help people stop using opiates. For instance, in 2014, a study in the Journal of the American Medical Association Internal Medicine found that states with medical marijuana laws saw a 24.8% reduction in opioid overdose deaths compared with states without such laws. And a study in the Journal of Pain found that those who suffer from chronic pain reduced use of opiates by a significant margin when using marijuana for medicinal purposes. Like, I don't think that any of us expect that marijuana would be a substitute in all pain management cases for opioids, but a strong anecdotal evidence and some clinical evidence indicates that at least for some of the cases of opioid use for pain management, a safer, less addictive alternative might be available in the form of medicinal marijuana. And we certainly shouldn't take an option with potentially much more limited or side effects off the table that could help free millions of Americans from horrific pain without the crippling addiction characteristics and strong danger of overdose that opioids, both prescription and heroin, present. My amendment would simply direct NIH to begin examining the benefits of the use of cannabis to either manage pain, so prescription opioids aren't necessary, or to help people wean themselves off of dependence on opiates if they can find effective pain management with medicinal marijuana. Perhaps by addressing this problem at the source, we can help mitigate dependency that will help reduce the overall number of substance-exposed infants as well. And I yield back.
Gentleman yields back. Dr. Rowe.
Mr. Chairman, I make a point of order that the amendment violates Clause 7 of House Rule 16.
The gentleman makes a point of order. The chair is prepared to rule. Germaneness is construed narrowly in order to support informed consideration of legislation. On this basis, the chair finds the amendment is beyond the bill's scope, which addresses the development of plans of safe care for infants born affected by substance abuse. The amendment is a proposition on a subject different from that under consideration with the meaning of Clause 7 of Rule 16 of the House Rules. Therefore, the amendment is not germane. The point of order is sustained. The amendment is not in order. Are members with other amendments? Let's go to Mr. Polis. Do you have an amendment?
I do. I have an amendment. I have an amendment to the desk, Polis amendment number 2.
Clerk will distribute the amendment. Dr. Rowe?
Mr. Chairman, I make a point of order that the amendment violates Clause 7 of House Rule 16.
Does the gentleman reserve a point of order? He does. Mr. Polis?
Thank you. Thank you, Mr. Chair. And I really think there's been, in the opening statements from members on both sides of the aisle, there's been very strong testimony, and I certainly add mine, about this scourge of opioid abuse affecting, of course, the innocent children that are carried in users, as well as cause so many countless deaths, so many families, countless pain, not just in my district, across the country. We really need to think out of the box, and obviously I do support the underlying bill. I'm a co-sponsor of the underlying bill. Information is good, it can be helpful, but we really need to do so much more, and we really need to solicit new, innovative ideas to be able to combat this scourge effectively. So I'm introducing an amendment that would encourage states to develop a plan for demonstration programs through which the Child Protective Services System, in consultation with substance abuse prevention programs, can help educate on the risk that children may gain unauthorized access to opioid medications that have been prescribed by their parents. Pilfering of legally prescribed medication is a huge problem and has helped directly lead to the scourge of opioid abuse. One proposed approach is to use to dispense opioid medications in prescription vials using new technology designed to permit only the intended patient to have access. So instead of those traditional containers which anybody can open, there's new technology like a pill bottle developed by an anesthesiologist in my district that has a locking mechanism which only the user knows the code for. Very simple, very low cost, help prevents the diversion of pills from those who were prescribed them to others in a household, including perhaps a 16-year-old teen mother in the household would not be able to access or would have a harder time accessing a parent's legitimate opioid prescription for pain management. There's many other similar inventions like this that are designed to address prescription drug abuse. Another example is a vial that includes a chip that enables a doctor to remotely monitor whether a patient is taking their medication and at what rate they are taking it. My amendment would encourage states to create pilot programs to educate about the risks of substance abuse and promote alternative solutions like this bottle, like the chip, like so many others. We need new ideas. We need creativity to combat this deadly scourge that is tearing families apart. It's touched families across our country, and so often it starts with the improper use of prescription drugs. We need to do everything we can to address this rising problem, including spurring innovation around how these controlled substances are dispensed. And with that, I would like to withdraw my amendment.
The gentleman withdraws his amendment. Are there others wishing to offer an amendment? Seeing none, the question now occurs on the amendment in the nature of a substitute. All those in favor say aye. Aye. All those opposed say no. The ayes have it. The amendment is agreed to. If there are no other members wishing to speak on the bill, I will now entertain a motion to report the bill and recognize Dr. Rowe.
Thank you, Mr. Chairman. I move that the Committee on Education and the Workforce report the bill H.R. 4843 to the House of Representatives with an amendment, and with the recommendation the amendment be agreed to and the bill as amended do pass.
The question is on favorably reporting the bill. All those in favor signify by saying aye. Aye. Those opposed signify by saying no. The ayes appear to have it. The ayes have it, and the motion is agreed to. H.R. 4843 is ordered reported to the House of Representatives. The chair notes for the record that a quorum is present. I now recognize Dr. Rowe.
Thank Thanks, Chairman. I ask unanimous consent staff be authorized to make necessary and technical changes to the bill and pursuant to House Rule 11, Clause 2L. I give notice that all members have the requisite number of days to file additional or minority views.
Without objection, so ordered. The committee stands adjourned. Thank you all.